A Melbourne hospital is paving the way for a treatment which helps to lessen the severity of COVID for people with underlying health issues. Approved by Australia's medical regulator last year, Sky News has been given exclusive access to an infusion clinic to see how it all works.
It's a treatment not many Australians know about, but doctors say it's saving lives. An intravenous infusion known as Sotrovimab helps to lessen the severity of COVID for people who are immunocompromised and sometimes not fully vaccinated. Sven Gutenbeil is receiving the one-off treatment at Sunshine Hospital in Melbourne's west, the state's first to open a 7-day-a-week infusion clinic.
Goodbye COVID, I hope. I hope I'm not going to see it again.
Provisionally approved by Australia's Therapeutic Goods Administration in August, the infusion is also used in places such as the United States, Canada and Singapore. It contains manufactured antibodies and takes half an hour to administer.
When Omicron peaked in Victoria, we had a really high volume of patients coming through the clinic with up to 17 patients in one day.
So among our 501 patients who were given this Sotrovimab in the outpatient setting, we have had 4 patients that required hospitalisation as an inpatient. So that is 0.8%. So I think that is a really, really good result.
Melbourne mother Kay Wennick, who is battling cancer, also had the infusion last month.
Oh, I'm glad I did, yes, because I was frightened of having to be hospitalised, and especially with the asthma, I didn't want to have problems with my lungs, and so, yeah, that was frightening.
There's no cost to patients, but there's one hurdle. It must be administered within 5 days of catching COVID, and it's for this reason GPs want better communication between pathology providers, public health units and a patient's regular doctor.
The most important thing is getting the patient to know the result quickly and the GP to know the result quickly so that they can actually determine who needs a test, what the test result is and who's eligible for infusion early.
While the infusion seems to be helping at-risk patients diagnosed with the Omicron variant of COVID-19, there's very little data on the effectiveness of the treatment on a new variant coined the son of Omicron. Regardless, it's another weapon in the fight against COVID ahead of a potential spike in cases come winter. Julia Bradley, Sky News, Melbourne.